Welcome to Ask the Expert, where we tackle your most searched health-related questions with science-backed advice. My name is Aamina Rafiq, and I'm the lead pharmacist.
I'm Abdal Alvi, and I'm the clinical director. And today we're going to be focusing on your biggest questions about Mounjaro in terms of how it works, what to expect, and how to use the medication safely.
Okay, so before we jump in, Abdal, can you tell us a bit about your background and what it is that you do?
So I'm actually a pharmacist by background, and I used to work in a community setting with a real focus on addictions. I've been working here now for about 5 years, and I oversee a large multidisciplinary team consisting of doctors, pharmacists, nurses, dietitians, nutritionists and others for one shared aim, which is to improve the pharmaceutical care that we're given to our patients.
Okay, amazing. And we know that there is a lot of information that is out there that's not always reliable or maybe easy for patients to get access to. And that's why we're here today, to support our patients with giving them the correct advice on some commonly asked questions.
Yeah, and we'll be covering everything from how long Mounjaro stays in your system to how to access the medication and how to even deal with any side effects that you might experience.
Okay, so let's get started. So our first question is, how long does Mounjaro stay in your system?
So Mounjaro has a half-life of about 5 days, which essentially means that that's the amount of time that it takes for the medication to drop to 50% in your body. Now, what that means for our patients is that it can stay in your system for 25 to 30 days. And that becomes really important for those patients that, for example, are maybe thinking about switching to a different GLP-1, in which case they would need to have an appropriate washout period.
Okay, and I take it that's also for patients who are maybe having like a break in treatment as well. They should contact their provider and ask for support on what medication strength they should go on to next or continue on.
Absolutely.
Perfect. Okay, so we'll go on to our next question, which is, can you get Mounjaro on the NHS?
The quick answer is yes. We do know that 1 in 3 patients in the United Kingdom are living with obesity. And we also know that NHS weight management services are pretty stretched. But we support the NHS. And what private online providers such as ourselves allow a patient to do is to access treatment. Within the NHS, normally a patient needs to be a BMI of over 35 and they need to have at least one comorbidity. But again, online providers such as ourselves have got a wee bit more room to be able to provide the medications to a wider range of patients.
Okay, so if we can move on to our next question, how does Mounjaro work for weight loss? So this is something that a lot of patients who are maybe thinking about starting a treatment like this are maybe wanting to know, how does it work? It is a new medication, so they would be interested in understanding that.
Absolutely, and it's such an important question. The way that it works is that it actually mimics hormones that are found naturally in the body, namely GLP-1, which is how most people recognise the medication, but it actually also works on another receptor called GIP. And those hormones are responsible for regulating a person's appetite. In doing so, by mimicking those hormones, it reduces a person's hunger. It allows them to manage their cravings and it makes them feel fuller for longer. And the outcome of all of that is that patients tend to eat less and make a lot of healthier food choices. But the key thing to remember is that it's not just about the medication. It's also about the lifestyle changes that a person makes. And it's really important for patients to have a balanced, reduced calorie diet and to also increase the amount of exercise that they're doing as well.
Yeah, so it's not a quick fix alone. It needs to be taken in combination with these lifestyle changes to see real results.
Absolutely. And it should never be seen as a quick fix. It's a medication which allows you to make long-term sustainable changes for your health.
Okay, perfect. So our next question is, what do I do when I'm at a healthy weight?
So it's important to understand that obesity is increasingly being seen as a chronic health condition. So medications such as Mounjaro can actually be used in the long term, and there's not actually a limit for how long you can use them for. Studies have shown that when a person stops using the treatment, they can regain some of the weight that they've lost. And naturally, that causes patients to feel a wee bit anxious. But again, it's important to note that the medication by itself can be very successful for patients, but it should really be used alongside some key lifestyle changes, such as introducing a balanced, reduced calorie diet and increasing the amount of exercise and movement that a person has, so that if they were to stop the medication, they've established a long-term habit that's going to allow them to keep that weight off. So the medication can be used in the long term, and there's not a maximum limit that you can use it for. But it's really important that patients also introduce those lifestyle measures, and both can work hand in hand to allow a person to keep the weight off.
Absolutely. And from my experience, along with my colleagues who are speaking to patients every day, a lot of our patients are at this point now, who have started treatment a while ago, are now reaching their healthy BMI range. So they're a bit apprehensive and a little bit nervous about what happens next. So I think that you've answered that quite well. And I think it's important for patients to know that you should seek support from your healthcare provider. And we're here in our service to support our patients, whether that be with our pharmacists advising patients on, what strength that they should go on for maintaining their weight that they've lost, or if it's our dietitians or nutritionists who can offer support and make sure that the patients have established good eating habits and are doing the right things to help keep the weight off. So patients have a choice and it's their decision ultimately, but we're here to guide and support them on what might work best for them.
Absolutely. And, I completely understand that patients do get anxious when they get to healthy weight because they worry that we're not going to prescribe to them anymore. And of course, these medications can be used to maintain a healthy weight. And that's really important for our patients to remember. But I would also add to that the fact that it's really important that a person's weight doesn't drop too low either.
Absolutely.
Because obviously that can be
unhealthy,
concerning and unhealthy. So again, it comes back down to keeping us in the loop and making sure that you're honest with your healthcare assessments and making sure that you're always entering accurate height and weight information as well.
Absolutely. Thank you. So our next question is, how long do you stay on Mounjaro for weight loss? So again, a common question for patients who are maybe looking into starting a treatment like Mounjaro for weight loss. They want to know, is this a short-term, long-term treatment? How does it work?
A lot of people do have kind of treatment goals that they've set or weight goals that they've set. And ideally, we would want patients to be on the medication all the way down to a healthy weight and to maintaining that. But the really key thing to remember is that outcomes vary from patient to patient. And no two weight loss journeys are the same. And it's really important for patients to acknowledge that. Mounjaro absolutely should be considered as a long-term treatment without any real maximum limit. But what's really important is that we as healthcare professionals work with the patient to make sure that we treat them as individuals and support them in whatever path they want to take on that weight management journey.
So it's very individualised treatment plans for every patient, because no two patients' journey is going to be the same. Absolutely.
And it's really important to note that patients should have a realistic expectation of what the medication can achieve for them. And when you've got a realistic expectation and you know that it's not one solution in terms of just the medication, that you're going to need to make those lifestyle changes as well, then again, patients are much more likely to make longer term, more sustainable changes for their
and
health.
Sticking at it, exactly.
Definitely.
And this is maybe going a little bit off topic, but it's still relevant. There's a lot of patients that we speak to every day, and we're trying to encourage them in how they can fit in different changes with their lifestyle, because for a lot of patients, this is completely changing their life. Maybe they've had really bad eating habits and poor, not as much movement in their lifestyle. So establishing manageable goals is what every patient should achieve for, so that they can get to the results that they're looking for. And it's not a overnight thing that is easy to do. It's very difficult, but you just need to set yourself achievable goals that you can can set to.
And that's so important. And you'll find a lot of information on our website and on our app as well that can help support you in making those changes.
Amazing. So we'll move on to our next question, which is, how do I get weight care treatment? So this is something that a lot of people do ask because they're maybe unsure about how do they get access to medications like this.
Absolutely. We're real believers that a patient should be educated and really empowered to make decisions about their own health. Now, you can access the treatment and all the information around it on our website. We have got an assessment form, which we believe is industry leading. And it really aims to allow our prescribers to make a decision as to whether or not the treatment is suitable for that individual patient that comes on to try to access treatment. And of course, it goes without saying that our prescribers may need further information. They may need more supporting evidence as well. But again, we treat each patient as an individual, and we make sure that the decision that's made is in their best interest, essentially.
Okay, so let's take the next question. What happens if I stop taking Mounjaro? Will I regain the weight? This is quite commonly asked, and I think some patients are also a little bit nervous about just stopping the treatment, and is it safe to do so?
So some patients will regain weight when they stop the treatment. But again, that's why it's so important to establish longer term habits and to make those key lifestyle changes, such as having a balanced, reduced calorie diet and increasing the amount of exercise that you're doing. Although Mounjaro does support weight loss, it's really those long-term habits and health strategies that are going to help keep the weight off.
Absolutely. If we move on to our next question, is Mounjaro safe for long-term use? So I think, again, some patients might be unsure about can they use this for a longer period of time?
Yeah, so Mounjaro is approved for long-term use. And that's both the case for weight management and actually also for type 2 diabetes. I think the key thing to note, though, is that it's really important for patients to have regular check-ins with their healthcare professionals to allow them to monitor progress and, if they're experiencing any side effects or issues with the medication as well.
Absolutely. So they're not in the journey alone. They should have support from their healthcare provider along the way.
Absolutely.
Yeah. Perfect. So we'll move on to our next question now, which is very common. Can I drink alcohol with Mounjaro?
It's important to note that there's not any formal warning about not using alcohol on Mounjaro. However, the effects of alcohol can sometimes make a person's side effects feel a little bit worse.
Yeah.
So it's something to be mindful of. If anything, what's really interesting is that Mounjaro has actually been shown to sort of reduce cravings for alcohol and a person's desire to drink as well. So there might actually be an additional benefit there for patients.
We'll move on to our next question, which is who can't take Mounjaro? So again, a lot of people that are maybe interested in a medication like this for weight management might be wondering, are they suitable for this?
Well, there's a few really important things to remember. The first thing is that Mounjaro is a prescription-only medication, which means that you should only ever try to source it from a regulated pharmacy or regulated provider. And one of the reasons why that's so important nowadays is because we're hearing a lot about patients that are trying to obtain these medications from social media and so on. Now, what that actually means is that quite often there's no assessment associated with it, and clinicians are not looking at the person's previous medical history or what medications they're on and so on. And that's obviously really important because there's instances where a person with a history of, for example, pancreatitis or of certain thyroid cancers, or if they're pregnant or breastfeeding, shouldn't be using the medication. So the key thing is really to only obtain the medications from regulated providers.
Absolutely, because they're going to be asking the correct questions to make sure that the supply of the medication is suitable for the patients. And I think it's really important to emphasise that patients should be making sure that they're filling out these assessment forms honestly and are letting their providers know if they have got any health conditions, just to make sure that the medication that we're providing to them is safe for them.
Absolutely.
Okay, so we'll move on to our next question, which is how are weight loss treatments prescribed by an online pharmacy? So it's a little bit different to our previous question.
So the first thing that I would say is that it's really important for patients to look for trust messaging on whatever site they're going to access these medications. So for example, the first thing that you can look for is the green cross and a registration number, which normally shows that the pharmacy is registered with the GPHC, which is the General Pharmaceutical Council, the regulator for pharmacies. It's also really important to note who the prescribers are and whether or not they're licensed, because if they're licensed, then they're going to be held accountable for the decisions that they make. And the final thing that everyone should be looking for is there an assessment in place? Always be suspicious if there's no assessment, because if there's no assessment, then they're not doing the appropriate background checks. And what are those checks? Well, we do everything from checking a person's ID details. We obviously ask patients about their medical history, and we ask them about their height and weight and so on. And all of that is reviewed by, in our case, a UK registered prescriber that's able to make the appropriate decision for each individual patient.
And with getting a medication like Mounjaro, do you inform the patient's own GP and there's that shared information passing on to them about a patient getting a medication like Mounjaro from us?
Exactly, and we feel it's really important for us to close the loop and to inform patients' own GPs of the treatment that we're providing, and we actually do that in every instance. And of course, what that also allows is it allows for the patient's GP to be in a position to intervene if there's any concerns.
Absolutely. So we'll move on to our next question, which is, can Mounjaro affect my period? So this is quite a common question that does get asked, and some people maybe have a bit of concerns before they start using this medication because they have heard this. What would you advise?
I mean, some users do report changes with their cycle, but the evidence is currently limited.
Okay.
The medication is still relatively new. What we would always advise is that a person reports any changes to their cycle onto their healthcare professional, including to ourselves. And certainly if a person thinks that they could be pregnant, that's another reason to reach out to us and to our patient care team or to your own GP.
Okay, amazing. So we'll move over to our next question, which is how quickly can you lose weight with Mounjaro? So again, I think this takes us back to some people are maybe wondering just if this can be a quick fix for them. But how would you answer this?
It's such an important question because patients need to have realistic expectations of what to expect when they're on the medication. Now, the most important thing to remember is the results vary from patient to patient, and clinical trials have shown that a person can lose 15 to 20% of their body weight over a period of 72 weeks. The key thing to take from that is that you need to persevere with treatment. It's really important that patients use the treatment as is intended, that they titrate up as is intended, and really follow that titration schedule so that they're getting the maximum benefit from the treatment.
Perfect. Thank you, Abdal. And we'll move on now to our next question. Side effects is something that can obviously occur with any medication, but what is the most common side effect of Mounjaro?
And I think that's really important because side effects can occur with any medication. With Mounjaro, our patients sometimes experience some nausea. They can get vomiting, constipation, diarrhea, maybe even headaches. But in most cases, it tends to be mild and your body can adapt over time. What's really important, though, is if a person starts to really feel unwell, that they report it on to our patient care team or to their own GP and seek some further help.
Okay, and they should also report them onto the yellow card if it is a new medication like Mounjaro, which everyone has access to online.
Absolutely, and those medicines are called black triangle medications, which means that there's a limited amount of use of the medication. And so the medicines regulatory body in the UK, the MHRA, have got a yellow card reporting scheme where if you do experience any side effect, you can self-report or you can pass that information on to our team who can report it on your behalf. Perfect.
And in regards to side effects, particularly about like nausea, there's quite a strong link, isn't there, with hydration and making sure that you're drinking enough water?
It's such an important call out, and it's really important for patients to maintain a really good level of hydration actually all the way throughout their treatment.
Okay, amazing. So we'll move on to our next question now. How much is Mounjaro in the UK? And this is a question that I think everybody wants to know is what's the costs?
And that can vary quite drastically between provider to provider. For ourselves, it ranges between £130 all the way up to £205, unless you obtain a bundle, in which case it can be a wee bit more. But again, the key thing is that patients use the medication as is intended, and they're following all the advice and the information that's being provided along with it, and that they're titrating safely as well.
Thanks for answering that, Abdal. And that was the last question for this episode of Ask the Expert. We hope that we have managed to answer some commonly asked questions that our patients have been asking about Mounjaro and about weight care treatment.
If you found this information helpful, make sure you like the video and please do subscribe to our channel for more expert advice on medications, treatments and patient care.
Okay, so thank you everyone for watching, and we'll see you in the next episode.
Thank you so much.